Well, what is the most important nutrient for your heart, your bones, and your hormones? And if you are deficient in this key nutrient, it would increase your risk of aortic calcification, hypertension, bone loss, osteoporosis, dental health problems, kidney and liver problems, including things like kidney stones, chronic kidney disease, as well as gallstones, and things like PCOS, insulin resistance, and diabetes. And so what would that nutrient be? Well, we could talk about a number of different things, but today I'm here to tell you about vitamin K2. So vitamin K was discovered by the Danish scientist Dr. Henrik Dam in 1929, and he found vitamin K1 and vitamin K2, and they're called phylloquinone and menaquinones. And so phylloquinone is vitamin K1. It's less bioactive in the body. It's found in leafy green vegetables, and it activates coagulation factors in our blood to help coagulate and clot blood. Now, vitamin K1 deficiency is extremely rare in adults. Vitamin K2 deficiency is actually extremely common. These are the menaquinones, and menaquinone 4 and menaquinone 7 are the two main subtypes of vitamin K2. They're found in animal foods as well as fermented foods, and they play a really critical role in getting calcium out of the bloodstream and into the bones, and also protecting soft tissue from calcification. They also help to activate different hormones in the body and regulate the immune system. And when you're deficient in vitamin K2, which is actually very common, it increases your risk of aortic calcification, hypertension, plaque buildup in the arteries, also any kind of calcification in the body. So thinking about kidney stones, joint degeneration in our joints, gallstones, periodontal disease, also increasing our risk of things like PCOS, insulin resistance, diabetes, and osteoporosis. So what are the main roles of vitamin K2? Well, number one, it activates osteocalcin from bone cells. And osteocalcin is actually a really critical hormone made by bones. And so we used to think bones were just kind of this inert, calcified structural compound, but they actually release hormones like osteocalcin, which helps pull calcium out of the bloodstream and into the bones. So vitamin K2 works with vitamin D and magnesium. Vitamin D actually helps get calcium out of the gut and into the bloodstream, and then vitamin K2 activates osteocalcin, which acts like a vacuum cleaner to pull calcium from the bloodstream and into the bones, to calcify the bones, to make them strong and sturdy the way we need them. Without vitamin K2, we can't activate osteocalcin, and we can't get the calcium we need into the bones, which is going to over time lead to bone loss, conditions like osteomalacia and osteoporosis. So activation of osteocalcin is one of the critical roles of vitamin K2. So number two is that vitamin K2 activates matrix GLA protein, which protects soft tissue like the arterial beds from calcification. So it's really critical, this matrix GLA protein, really critical for protecting the blood vessels from becoming calcified. When the blood vessels become calcified, now blood pressure goes up because they lose their elasticity. It also causes scar tissue formation in the blood vessels, which reduces blood flow to different areas of the body and can cause blood clots and blood occlusions, as well as arterial calcification and aortic calcifications, obviously increasing our risk overall of heart disease. So the Journal of Nutrition actually looked at over 4,800 people, and they looked at vitamin K2 intake, and what they found was that individuals that had the lowest rates of vitamin K2 intake, they actually had a 51% increased risk of mortality from heart disease compared to those with the highest levels of vitamin K2 intake, and a 26% overall increased risk of mortality or dying from all causes compared to those with the highest levels of vitamin K2 intake. And this goes to show how important vitamin K2 is for activating matrix GLA protein and inhibiting calcification of these critical soft tissues of the body. So the third big thing that vitamin K2 does is it improves our oral health. In fact, so there was a 2023 study where they looked at 100 patients, 50 that had periodontal disease and 50 that didn't. And what they found was that there was a correlation between those with the highest levels of vitamin K2 and lower risk of developing periodontal disease. So individuals that had the lowest levels of serum vitamin K2 had the highest risk of developing periodontal disease, and those who did not, or those who had sufficient levels of vitamin K2 or good levels, highest levels, they had the lower risk of developing periodontal disease. So the fourth big thing about vitamin K2 is it activates the intranuclear SXR receptor, which then activates a whole number of genes. In fact, when we look at vitamin D, we always say it's incorrectly named. It shouldn't be called a vitamin, it should be called a prohormone because of its impact on all the hormones of our body and how it activates so many different genetic pathways. Well, vitamin K2 is very similar to vitamin D in that it activates all these different genetic pathways through that SXR receptor, and it activates osteocalcin again, which pulls calcium from the bloodstream and puts it into the bones. And osteocalcin is this critical bone-building hormone. Well, vitamin K2 has also been shown to help reduce the symptoms and severity of PCOS, polycystic ovarian syndrome. It also has been shown to help improve conditions like endometriosis and lower the risk of conditions like breast cancer that can be associated with hormone balance. It's been shown to balance the estradiol to estrone ratio in our blood, and estradiol has a stronger growth effect. It's a form of estrogen that signals a strong growth effect to the cells, whereas estrone is a more milder growth effect. And so the better that ratio is balanced, the lower the risk of developing estrogen-related cancers, endometrial cancer, ovarian cancer, breast cancer, and so very critical for that balance. It also activates protein kinase A, which helps increase testosterone in males, and it activates adiponectin, which is actually a hormone that's released by our fat cells that helps regulate insulin sensitivity. So it helps improve insulin sensitivity, helps reduce cravings, helps turn on fat burning, and reduces overall inflammation in the body. And so it really has a profound effect, vitamin K2, on overall hormone balance in our body. If we're looking to optimize our hormones, we need to be thinking about vitamin K2. Vitamin K2 also helps support healthy immune function. We know that by activating matrix GLA protein, it helps reduce calcification, but it's also been shown to help balance the immune system and bring down systemic inflammation in the body. And then on top of that, it improves kidney health. Anytime we're improving blood flow, we're going to improve kidney health. When people develop something like chronic kidney disease, typically that's related to hypertension and damage to the arterial lining of the blood vessels. In fact, when we think about somebody with uncontrolled diabetes or somebody that has high levels of glycation, these sugar molecules that bind to proteins and create damage in the blood vessels, one of the big things that diabetics get is they develop chronic kidney disease because these AGEs, these glycation end products, damage the blood vessels. Well, we know that vitamin K2, by activating matrix GLA protein, helps to prevent against that sort of damage to the blood vessels, prevent against calcification of the blood vessels, and improves overall blood supply, improving kidney function. On top of that, by reducing calcification, vitamin K2 helps prevent and reduce the risk of developing kidney stones. So we get improved overall kidney health by optimizing our vitamin K2 levels. So now, what are the best foods when it comes to supporting vitamin K2 levels? Vitamin K2 is not easy to find, at least not in high levels in foods. There is a fermented soy that's native to Japan. It's called natto, and the Japanese eat this on a regular basis, but very few Americans and Europeans eat it. Again, it's called natto, and it has 300 micrograms of vitamin K2 per ounce. Now, the general RDA is going to be about 100 micrograms daily, so you get a huge dose in the natto, and that's extremely helpful. And individuals that eat natto have a lower risk of developing things like osteoporosis, osteoarthritis, cardiovascular disease. Why? Because they're getting so much vitamin K2 in it. But it can be difficult to source good natto. So what are some other good sources? Well, goose eggs, which again are another challenging source to find, but they have 105 micrograms of vitamin K2 per ounce. And then you've got things like just regular eggs. So good eggs, and if something is pasture raised, it's going to have a higher amount of vitamin K2 than a conventionally raised egg, roughly about 40 to 60 micrograms per egg yolk. That's where the Vitamin K2 is going to be condensed in the actual yolk of the egg. So egg white, you're not going to get the vitamin K2, but in the yolk, you're going to get 40 to 60 micrograms of vitamin K2. Hard cheeses are another source of vitamin K2, roughly about 20 to 25 micrograms of vitamin K2 per ounce of hard cheese. Soft cheese, you get about 10 to 15 micrograms per ounce of soft cheese. And then you've got to look at things like beef liver. You get about 5 micrograms of vitamin K2 per ounce of beef liver. And sauerkraut, you get about 5 micrograms per ounce of sauerkraut as well. There's a type of bacteria in sauerkraut. It's called Lactobacillus plantarum. It also is a commensal bacteria in our gut, and it produces vitamin K2. So when you get a good quality sauerkraut, you're going to have that Lactobacillus plantarum. You're going to have some level of vitamin K2. And some sauerkrauts have higher amounts than others, but the average sauerkraut that you'd find on the market, roughly about 5 micrograms per ounce of sauerkraut. In meat, like grass-fed red meat, you're probably looking at about 2 micrograms per ounce. A more conventionally raised animal product, maybe about 0.5 to 1 microgram per ounce. So really the best source of vitamin K2 that most people are going to be consuming on a regular basis is going to be egg yolk. Again, 40 to 60 micrograms per ounce. The more grass that the chicken is eating, the more pasture raised, the higher amount of vitamin K2 is going to be in that yolk. So kind of the more orange colored yolk, you're going to find more of the vitamin K2. So look for pasture raised eggs to be a really good source of vitamin K2. Now, how much vitamin K2 do we actually need? Well, they say the RDA is roughly about 100 micrograms or so, 90 micrograms, but that's actually a combination of vitamin K1 and vitamin K2. Scientists and nutritionists have not actually come up with a separate RDA for vitamin K2. They've kind of got this overall, okay, 90 to 100 micrograms of vitamin K1 and vitamin K2 together, but it's pretty easy to get vitamin K1. In fact, a half a bowl of cooked broccoli has about 110 micrograms of vitamin K1. So really easy to get that, and it's very rare that adults are deficient in vitamin K1. Vitamin K2 has not been classified. Scientists and nutritionists have not actually found what the recommended daily allowance is for vitamin K2. And so most researchers, most functional health experts are going to recommend somewhere between 50 to 300 micrograms. Now, you really don't get toxicity levels until you're around 800 to 1,000 micrograms. So there's a lot of leeway there. What I recommend is about 100 micrograms or more a day, somewhere in the, like, let's say 100 to maybe 300 to 400 micrograms per day, either from diet or supplementation. Again, if you're eating a lot of eggs, you're going to get that through diet. Otherwise, you can also get it through supplementation. When I'm looking for supplements with vitamin K2, I'm usually looking at somewhere around 90 to 100 micrograms of vitamin K2. In some cases, like people maybe that have a lot of arterial plaquing, or people that have osteoporosis, periodontal disease, I might do higher amounts in supplement forms, maybe 300 micrograms once a day or something along those lines. And you can find supplements that have that level. And then of course we want to consume it, right? By getting good quality pasture-raised eggs, pasture-raised or grass-fed animal products, consuming that. Sauerkraut, again, another good source of vitamin K2. And then we want to support our gut microbiome, because our gut microbiome should naturally be producing vitamin K2. The problem is most people in our society have very low levels of vitamin K2 producing bacteria in their gut microbiome because they have dysbiosis. Their gut microbiome is altered and they're not producing much of that K2. Now, what are some of the best vitamin K2 producing